The PayPal link to make a donation is on my YouTube channel. So please, please support independent media. And so the next guest, ANNETTE GAUDINO, is
Hello.
Annette?
Yes.
Thank you for joining me on Organic News on Awake Radio. ANNETTE GAUDINO from Physicians for Single Payer Healthcare?
Physicians for a National Health
National,
Program.
sorry. I have okay, yeah, thank you so much. So explain what Physicians for National Health Plan.
Yeah. So thank you very much for having me.
Sure.
I'm really appreciative of the opportunity to talk about PNHP and the work that we're doing. Physicians for a National Health Program, I work with the New York City chapter. It's a nationwide organization of thousands of physicians that organize and advocate for universal health care here in the U.S. I'm also the statewide coordinator for the Campaign for New York Health. And the Campaign for New York Health is a coalition dedicated to bringing universal health care to New York State through passing the New York Health Act, which is a bill that's currently in the New York State legislature. And we passed the bill through the Assembly last year in May, a vote of 92 to 52, almost a 2-to-1 margin. Right now, we're trying to tackle the Senate, the upper house. We have 20 co-sponsors signed on for the bill, and we need 12 more votes in order to pass it through the Senate and get it on the governor's desk. So we're working this year to build our support in the Senate.
And so how is this comparing to Obamacare? Like, can you, go ahead, like compare the two.
Sure. The ACA really helped millions of people across the country. I think the last estimate I saw was something like 8 to 10 million people now have access to the private insurance market through the ACA. But it's important to understand that the ACA was never going to transform the healthcare system, because it was only really designed to tackle the 4% of Americans who either buy insurance for themselves because they're freelancers or work for a company that's so small that it doesn't provide them with health insurance. So it was only designed to open up the market and to protect people who are in the individual private insurance market. And it was also designed to keep the majority of our system intact. So most people get their insurance from their job through a private insurance company. And then we have other programs like Medicare that covers anybody over 65. We have the VA for veterans. We have some federal money that comes through the Children's Health Program that goes to states to cover children. And then we have Medicaid. Medicaid is paid for by states and the federal government together. So with all these programs and with the ACA helping people get insurance, we still have 33 million people who have no insurance, no coverage through Medicare, no coverage through Medicaid. And that's the problem. What the New York Health Act would do is the only requirement for having healthcare, access to healthcare, would be being a New York State resident. From age -9 months to the rest of your life, if you're a resident of New York State, you would get access to care. That care would be free to you at the point of delivery. That means you wouldn't have to bring your wallet to the doctor.
Yeah, I was just going to say, is it affordable?
Yes. So for an average person, you don't have to bring your wallet to the doctor. No copays, no deductibles, no out-of-pocket costs when you go to the doctor. Why? Because we know that out-of-pocket costs are barriers to people. The Kaiser Foundation just released a report. 24% of Americans reported not filling a prescription because they couldn't afford the copay. 34% of Americans report themselves or someone in their family not going to the doctor because they can't afford a copay or an out-of-pocket cost. The reason that we're able to do this, cover everybody, and And when I say New York State residents, I mean without regard to your federal immigration status. If you're here and living in New York, you would be covered. Why are we able to do this? Cover everybody and not charge you anything at the door. Because right now, our healthcare system, about 25 to 30% of every dollar that we spend goes either to an administration, doesn't go to pay a doctor or a nurse or a clinic, it goes to an administrator. And some of that money goes right up to the top of the CEOs of the insurance companies who make tens of millions of dollars. Right. And most of these companies are publicly traded on the stock exchange. So they're also trying to keep their stock market value up and pay dividends to their investors. So because we have profit in our system, so much of our healthcare dollars just doesn't go to healthcare. And when we stop doing that, we'll see that there's plenty of money left for everyone.
See, this is like, when I really, really have to start scratching my head because, I really, along with the for-profit prison system, I'm completely, my mind is boggled that we live in this kind of a country. Like, I literally cannot believe, I don't know, call me naive, call me, this makes absolutely no sense to me. And how people put up with it, it blows my mind. How do we put up with for-profit health? Clearly it doesn't work, and clearly, they're going to be making the money at the top and wanting to keep people sick. And like I was just saying to the two previous guests before you, who all three of you spoke at the 4th anniversary at Occupy Wall Street that everybody thinks is dead, but really isn't, is that so just like the monetary system and just like the court system, and now you're talking about healthcare, it's like the fiat currency. It is the opposite of value. So the healthcare system, it's the opposite of healthcare. The so-called justice system, it's as long as there's a profit motive, it's like a no-brainer that it's going to be the opposite of what they're calling it. And for that is not rocket science. How do people go along with that?
That's a really good question. One thing that we need to remember is that among rich countries, we are the outlier. We spend twice as much per person to not even cover everybody, and we're the only one that allows profit in our system. Even some countries like Switzerland or the Netherlands that have a system where you pick a insurance plan, right, that you go on, and they do have some out-of-pocket costs. What they call an insurance company there is a completely different animal. Those insurance plans are nonprofit. Their CEO might make 6 figures, but they don't make tens of millions of dollars. What must be covered under those plans is really strictly regulated so that everybody gets access to preventative care and the whole range of medical services, as opposed to here where insurance companies can pick and choose. They don't have to deal with, is their doctor in network or out of network? If, basically you're covered in the entire country. All the physicians in the countries are part of these plans. So even in countries that don't have a purely publicly funded system with no out-of-pocket costs, what they consider, the bottom, the basic plan and what insurance companies should do is completely different from ours, which is so infected by finance, high finance, Wall Street. You're seeing it right now. It's been hitting the news. These hedge funds and these investors who are buying up drugs that big pharmaceutical companies just don't want to deal with anymore, and jacking up the price by 5,000%, 6,000% overnight, and that can only happen in a system where we don't recognize that healthcare is a human right, and we instead see it as a way for people to profit off of illness and suffering. And it's morally reprehensible, and it doesn't even make any financial sense.
But also, I'm going to point out the fact that because, war is also for profit, and that is I would, like the biggest expense,
Mm-hmm.
like that's like sort of, I would imagine it's the kind of largest for profit,
Mm-hmm.
I don't, institution, everyone is talking about the military industrial complex and how it has to end because,
Mm-hmm.
so,
And and that affects healthcare too in two ways. One, on the one hand, you've got the VA, right? And the VA, everybody loves to kick the VA. The VA is the closest that we have basically to socialized medicine. Everyone that works for the VA is a public employee. It's funded through our tax dollars. It gets budgets. I have friends, I'm a speech therapist. I have friends who work in the VA as physical therapists. They love it because patients come in, they see them. If they need equipment, they go to the storeroom, they give them what they need. And it's just the simplest, best way to do healthcare. But what happens is it doesn't get the respect it deserves, and then they'd rather build a bomber than take care of the veterans that result from the wars that we fight. And it's even worse than that because the military has its own healthcare service. So while you're active duty, you see military doctors. And we know PNHP heard this at a forum that we did last year on Veterans Day, that military doctors will give people dishonorable discharges so that they can't access VA services. Or if they have an issue, they'll say, you know what, let's not take care of this now. Just wait until you get the VA. And they push, costs onto the VA, or they deny veterans care. And it's just, it's a game. It's a rigged game, and they're playing with people's lives. So, however you slice it, there's just so many different ways in which healthcare in the U.S. is, the last thing that it's about is health.
So, yeah, I am just completely, my mind is boggled by this country. I mean, and other countries must think that we are like crazy.
Right. And they do. They do. I read.
I mean, we are.
Yeah. I read The Economist. The Economist is basically like the Wall Street Journal of England. It's a very conservative, very pro-capitalist magazine. And I read it because I like their international coverage. But it's really interesting to read their commentary about our healthcare system, because even this like Bible of capitalism is like, what are those Americans doing? This doesn't make any sense. So that just goes to show how all of the way we view this is very ideological. One thing I was going to say is, most Americans don't have a passport. The majority of Americans don't travel outside the U.S.
Right.
So it's pretty easy to believe the propaganda that we have, quote, the best healthcare system in the world if you've never experienced anything else. If you've never gone somewhere else and either talked to people about what they do when they're sick, and how they're able not to worry. I lived in England for a year, and I got strep throat while I was there. And I was able to go to the doctor. Sure, I had to wait. It was I didn't have an appointment. I was so sick, I just showed up at his office. And I had to wait for about 15 or 20 minutes. I saw the doctor, and he wrote me a prescription. And he said to me, I'm so sorry to have to ask you this, but I'm going to have to ask you to give me some money because I had forgotten to pay my registration fee. Like I was required to register just so that he would know who I was. So he was asking me for the fee right then and there. I should have paid it before. And he was just sick about having to ask a sick person for money. That was so completely outside of his experience.
Wow.
And he was embarrassed and ashamed. And I was like, I'm an American. I'm used to, just tell me what the bill is. Just give it to me. And it was like $15. It wasn't even like an amount that I would have worried about. But again, like from his experience and from his point of view, to ask somebody who's ill to open their wallet was just reprehensible to him, and he'd never had to do it before.
I wanted to mention, it has to be at least 2 years ago that, your group, the Physicians for a National Health Program, held an event in Washington Square Park. I remember I videotaped it, and it was this sort of healthcare hospital tour.
Mm-hmm, mm-hmm.
And we walked, by because you know they had closed St. Vincent's Hospital, which was the only hospital in Lower Manhattan, and of course turning it into condos. And I remember he was I forget his name, but he was an emergency room physician who stood there. It's on my YouTube channel.
I'm pretty sure that was Danny Lagasse. But anyway, yes, I remember the event you're talking about, and it was, you know, we went to St. Vincent's. We also stopped by a couple of other hospitals that had seen their funds cut and, you know, were really overburdened. One of the ways that the New York Health Act would help that situation, and of course there's the situation in central Brooklyn where we've seen hospitals closed or being threatened to close, is every patient, no matter where you got your care, your doctor and or the hospital would be reimbursed at the same rate. So if you got heart surgery from Dr. Oz in Columbia Presbyterian, or you get heart surgery, you know, from Kings County Hospital or from Bellevue, the state would pay the same fee. What happens right now, and this is a law that changed in 1995, up until 1995, that was the law in New York State. All insurers, private insurers, had to pay the same rate no matter where you got your care. And when that law changed under Governor Pataki, people predicted hospitals will close because insurance companies will pay a higher reimbursement rate to fancy hospitals who are on Upper East Side than they will pay to hospitals in poor communities, and it'll cripple those hospitals and they'll close. And that's exactly what we saw. He
said on this emergency room doctor said that the reason you know, you can go to Cuba or something and get an appendicitis for like, I don't know, $3,000 or something. And here in the United States, it would cost you like $9,000. It's just like, I mean, he again, like I don't have his exact words, but the way he described it, it was just pure ego. It was literally just like, you know, financial Botox.
They just do it because they can. Like we've seen, you know, pills. Asthma is a perfect example. You know, kids especially who have, you know, really severe asthma, they need their inhalers. They could die without them. The price of an inhaler in this country has gone from being something like $5 to $10 for a single inhaler to $300 for an inhaler, a one-use inhaler. And there's no reason for that other than they can get away with it.
I mean, so this is what I'm saying. Like, you know, and just like medication, like it's not a healthcare system. It's like it's just being in an abusive relationship. Like this is the way, you know, because I was a psych major. I studied psych. I've been trying to tell people about abusive, dysfunctional relationships, you know, like starting with the family system on out, like even at work or expanded outward. And that is really all we're living under. Because exactly, if you are in a relationship with either whatever, a parent or a spouse who has this power over you, and if they're not a healthy, mature, responsible person, there's no way that they're not going to kind of get off on abusing it. And so that
you can't thrive in the system that we have. You know,
that's why I mean, like I just always wanted to get the point across to people that you know, like what is most important is someone's health. That, you know, it doesn't matter if they're a doctor, a lawyer, or a judge, or garbage man, or whatever. If someone is not emotionally healthy, they're going to use their position to abuse you.
Right. I mean, two things. One, if you break your leg, you can't go shopping. So this whole idea that like the market will somehow can function when you're talking about healthcare is completely ridiculous. When you need it, you need it. You can't go around like, oh, I'm going to compare prices. You're in pain. You're suffering. You need care, period. The second thing, I'm really glad you brought up psychology and just our thought processes around this, because I recently sort of stumbled along an analogy. I think what we're dealing with right now is that there's been a flood. The flood has come, and some people have drowned. We've actually lost people, you know, in this flood. And the survivors are clinging to their life jackets, and they're clinging so tightly with both hands because they're so afraid of drowning that they can't reach out a hand to the person who's in the lifeboat trying to bring them to safety, right? So the life raft, the life jacket that people are clinging to with both hands is their crappy private insurance plan that has a $2,000 deductible, that has a limited network, that has, $25 copays, that, doesn't cover their prescription drugs. It's really kind of crappy, and it's not serving them, but they're so afraid of drowning like the other people that they've seen drown that they're just holding on to it. And single payer and the New York Health Act is like the lifeboat that's there to come take you out of the storm, but people need to relax their grip on the crappy thing that they had in order to reach out and grasp the solution. So a lot of it is, that's why I really thank you for this opportunity, because just to get people thinking, this isn't a fantasy, this isn't a pipe dream. Not only is the rest of the world doing this, but here in New York State, we're actually making, concrete progress politically to making this a reality. So, I think most people are like you. Most people see the current system doesn't work. It's crazy. Healthcare is a right. We should treat it like a public good. But they think, oh, it'll never happen. And I guess I'm here to say, like, it can happen. It is happening. Like, with your help, like, we can do this.
So let me. Oh yeah, we have like 4 more minutes or 3. Yeah, so we can still use those. And so like, how close? Like, what do people have to do to get this kind of thing, passed?
Sure. So there's a bunch of things you can do. First thing is to go to nyhcampaign.org, NewYorkHealthCampaign.org, and on that website, you're going to see a little tab that says "Take Action." Click on that, and it'll take you to a petition that we're gathering signatures for to go to the Senate. The other thing that you'll learn, and we're going to be updating the website, and we're going to be sharing things like on Facebook and stuff, is you can meet with your local senator. And we, if you give us your information, we can plug you in. We can let you know if your senator is a supporter, and you can call them up and say, thank you for supporting the bill. And if they're not a supporter, you can find out ways to help lobby them. Because like I said, we're about 12 votes away, and we want to pick up as many votes as we can. There are senators upstate that need to get the message in Buffalo, in Rochester, and in Syracuse. There are senators downstate in Rockland County and in the Hudson Valley that need to get the message. There are senators in New York City, in Brooklyn, and in Queens that need to get the message. So we're going to be organizing, hopefully, some community events, but again, like in-district meetings and phone calling, and writing letters. And the other thing you can do is to talk to your friends. If you're listening to this program right now, talk to your friends about your experience of the healthcare system and tell them what you heard. And, because breaking through the cynicism and breaking through like, oh, this will never happen, I think is one of the most important things that can happen right now, because we've seen with issues like banning fracking upstate or gay marriage or medical marijuana, for a long time, the majority was feeling that these things needed to happen, right? But they were everyone was like, yeah, we feel this way, but nobody else does, or the politicians will never allow it to happen. But when we hit critical mass and we're in the majority, we're already in the majority, things can change and things can happen really quickly. So reaching out and talking to your friends, this is something I learned in Occupy, find out what they think about this issue and talk to them about it. And then together, you'll see that the majority of people want this. And then if you go to nyhcampaign.org, follow us on Twitter, NYHcampaign, that's how you can plug into the work that we're doing this session to get this thing passed.
I saw, and I just found it, this post that was, I think, Lee Camp, the comedian. It says 32-year-old hedge funder buys rights to AIDS medication and raises the price from $13 to $750 per pill.
Yep.
This is a symptom of a completely diseased economic system. It rewards sociopaths.
I did see that, and that's absolutely correct.
I mean, it's correct. Just, like, how much more ridiculous does it have to get?
Mm-hmm. So that's, I mean, think about it. There are 3 presidential candidates running this election cycle that support single payer. Jill Stein from the Green Party, Bernie Sanders from the Democrats, and of all people, Donald Trump from the Republicans. This is becoming a mainstream issue. This isn't like a niche issue. Everyone's talking about this because everybody is seeing what's not working, you know?
Annette Gaudino, thank you so much, from Physicians for National Health Program.
Yes.
So it's PNHP.
That's right.
And for more information, and I again, like, I hope you can come back on, and I think it's good to just keep talking about this stuff. Like,
thank you so much for the opportunity. I really appreciate it. And it was great seeing you and everybody at the OWS 4th anniversary. We're still here because Wall Street is still here. And yeah, nyhcampaign.org. Check it out.
Thank you so much, Annette Gaudino.
Have a good night. Thanks.
You too. Bye.
Bye.
Okay, so that was our last guest. And for the last half an hour, again, I wanted to remind everybody they had Occupy Peace over the weekend. Please check out the videos. They're on my YouTube channel. And I was going to play, I wanted to play some of Cindy Sheehan. Please make a donation to the PayPal link on my YouTube channel, April Waters with double T.